The Tuskegee Syphilis Experiment is one of the most horrifying and unethical medical studies in American history. Conducted between 1932 and 1972 by the U.S. Public Health Service in collaboration with the Tuskegee Institute, the experiment targeted 600 African American men from Macon County, Alabama. Of these men, 399 had syphilis, while 201 were disease-free and served as a control group. The men were mostly poor, uneducated sharecroppers who were not informed of their diagnosis or the true nature of the study. Instead, they were falsely told they were being treated for bad blood, a vague term that many believed referred to common ailments. The goal of the study was to observe the natural progression of untreated syphilis. Even though an effective treatment, penicillin, became widely available in 1947, shockingly, the researchers chose to withhold treatment from the infected men, despite the fact that syphilis can lead to severe health problems, including blindness, mental deterioration, heart disease, and death. The participants were never informed that they had syphilis, nor were they given the option to seek alternative medical care. In return for their participation, the men received free meals, medical exams, and burial insurance, but their suffering was immense. As the years passed, many of the men experienced the full, devastating effects of the disease, passing it on to their wives and children. By the time the study was exposed in 1972 by a whistleblower and subsequently shut down, 128 participants had died, several wives had been infected, and 19 children had been born with congenital syphilis. The Tuskegee Syphilis Experiment represents a gross violation of medical ethics and human rights, particularly against an already marginalized community. It eroded trust in the medical establishment, especially among African Americans, a legacy that still lingers today. In 1997, President Bill Clinton issued a formal apology to the surviving participants and their families, acknowledging the racism and cruelty that had underpinned the experiment, but the damage done to the lives of those men and their families can never be undone.